My name is Joe. I'm a co-founder here at Guusto, and today we are joined by Kevin Kirkpatrick, the founder and vice president of search services at the Avery Professional Group. So a lot of current healthcare retention challenges have been linked to post-pandemic burnout. What do you think organizations in the healthcare sector can do to improve employee well-being?
So, it's interesting because I've been working in healthcare for about 15, 16 years now. So for a long time prior to the pandemic, right? And, the pandemic is an exacerbator. It is not the creator of the problem, right? Like we had a problem before this, and, the system has to start building capacity for actual need, not perceived budgeted need, right? So we really need to identify what the needs of the population is going to be and start building a system for that, as well as prorating that over the next 5 years, right? Or 10 years, because, the only way to fix things are to add more staff and make the work easier, right? So, but to make the work easier, we need more people doing the work. So we need to increase team-based care. We need to increase the residency spots. Why do we have people going to med school in the Caribbean or in the US? Why can't they go to med school in Canada? Why are we seeing nurses drop out of the profession, right? So a lot of it is until we fix that experience. So the pandemic has moved us from 90% usage to 103% usage. So it's exasperated a problem and brought something to light because of the public nature of the pandemic. And we need to really start looking at supply and demand, maximizing that. We've got some new medical schools coming, so that's good. We need to do the same thing for nurses and allied health staff and stuff like that, right? Like we need to train enough people that there are more people that are, having to fight for a job as opposed to, anybody getting a job that graduates, right? And then looking at the ways that we can get down and dirty in a clinician's day, figure out how we can make their work more, more palatable, right? Being a nurse is hard. It's always going to be hard, but can we take away something and, use a technology or use, somebody else that can do that work? Like it's looking at the right person doing the right work at the right time, as opposed to, hoping a nurse is going to do all this work, right? Like, maybe we need more PSWs, or maybe we need physician assistants like the US, or, and truthfully, I think we need more nurse practitioners, right? So, you can only rely on more so much. So we have to look at how do we get more practitioners or clinicians, but also how do we make their lives better? So the organizations that are employee driven and employee first will outperform the organizations that solely look at the needs of the organization and then try and push that on their employees.
I love that. And, being so close to healthcare, reading the tea leaves, do you feel like we're heading in the direction of solving many of the challenges that we're facing here in healthcare?
No, unfortunately. And I'll have to admit, I'm being, a lot of that comes from being in Ontario right now and seeing the emerge shortages, right? And the emerge closures and stuff that's happening. I'm really worried about the sustainability of the system unless we make drastic changes. And unless those changes are driven by the care providers and not by politicians, right? Because I'm not anti-politician by any stretch, but when someone in Queen's Park determines what the budget's going to be, and in February we can't do any more orthopedic surgeries because we've run out of budget. I mean, this happened down in the London area, right? They ran out of budget, so they had to go 2 months until the next fiscal year before they could do any more orthopedic arthroplasties, right? So, until we focus on, the care providers and stuff like that, like I'm really worried. Next week I'm interviewing an emerge doc who basically has been going from emerge to emerge to keep emerges from closing. And he's often the solo emerge doc in these rural emergency departments. And rural health is getting worse and worse. There's no access to primary care because not as many physicians want to go work in a rural area than would rather work in a suburban area. And we're not incentivizing them to do so. So I kind of feel like Henny Penny or Chicken Little, they're saying the sky is falling, but I don't feel like we've done enough to start righting the ship. So I think it might actually get worse before it fully gets better.
It's a frightening prospect, Kevin.
It doesn't make me feel great, and it gives me some good encouragement to exercise a bit more, so I don't have to see a doctor. But it's worrisome, right? And I read an article yesterday in the Globe, I think it was, that 16 emerges in Manitoba were closed on the long weekend. Can you imagine being somebody in that you're building your deck in one of those communities and you put a nail through your hand? Well, you're going to have to drive an hour, 2 hours to another emerge because your local emerge is closed. And that's just a minor example. What about the heart attacks, right? Like it's, until we really hold people accountable to build a system that serves the needs of the community, we're going to be at a tough spot.
Recognition can be a great way to improve healthcare culture and retain more staff, but implementing a program in the sector has its challenges. Check out Employee Recognition for Healthcare, the complete guide to learn how to do it effectively. Click the link in the description to get your copy. Thanks for watching, and be sure to check out full episodes on our channel. You can also listen to the Culture Clinic on the go wherever you get your podcasts. Please like this video and subscribe to see all future uploads. And don't forget to recognize someone for a job well done today. Mucho gusto.